We're continuing our discussion on the coronavirus or COVID-19 pandemic. With new case numbers on the rise throughout the country and holding steady here in Florida, many residents are asking what we should do next. Face masks are required throughout many Central Florida communities, and more testing sites are opening to accommodate the numbers. But what does all of this mean for you? On this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our local medical professionals. And joining me is Alvina, epidemiologist with the Florida Department of Health in Orange County. Thanks for joining us, Alvina. How are you today?
Thank you. Great, thank you. Thanks for having me.
Well, we got some good news. We've seen the numbers, COVID case numbers decrease here in Orange County. What do you think is behind the decrease in numbers?
Right. So we're cautiously optimistic. There is a decrease. It's slight. Looks like we might be heading towards a downward trend and possibly a plateau. There was the large increase after Mother's Day and Father's Day and also 4th of July. So we're hoping that the message is getting out that people are social distancing and trying to avoid large groups and gatherings. And so we're optimistic that people are doing what they're hopefully supposed to be doing to help everyone reduce the numbers of infections in our community.
And hopefully we can keep it through Labor Day as well. One of the questions that a lot of people are starting to ask as kids are starting to get ready to, on some level, go back to school or go back to school online, but they're going to be socializing a little bit more because it's fall. How does COVID impact different age groups?
So I think I previously mentioned that so everyone is susceptible to this kind of infection if they haven't had it before. And since it's a novel coronavirus, pretty much the world does not have had it before. So we had gone over the median age currently is around 40 to 41 in Orange County and in the state. All age groups have been affected. So our age range for all of the cases is 0 to 106. And so if we look at specifically the pediatric infections, we see that the highest numbers are in those children who are under 18 who are also of school age. And so just want to make sure that people know that children can be infected and they can potentially spread the virus to other persons. And we want to make sure that we try to protect those who are living in multi-generational households, that we use those precautions such as separating, distancing within your own household. If you live with other family members who are medically vulnerable or susceptible to or higher risk for severe or serious infections. So we have seen that most of the deaths, if we look at the age breakdown for deaths, it primarily occurs in those who are much older, so in the greater than 75 to the and up age group.
You know, you mentioned the multi-generational transmission of the coronavirus. How do we work to slow that kind of transmission?
So really, it's if you look at the overall age breakdown, the people who are mostly getting infected initially are those who are in the younger age group. So I said the median age overall is 40, but so for those persons who are somewhere in the 25 to 35 age range, they're the ones who are getting infected. But then if you look at hospitalizations for that age breakdown, you see that the median age there increases. And then if you look at those who are severely affected and those who die, it's the oldest age groups. And so what we'd like to emphasize is for those young persons who are going out and possibly gathering, or who have to go out and do their jobs if they're in a critical industry, that you are making sure that you are aware of covering your face so that you're containing your droplets, preventing transmission, watching your distance, and also carefully washing your hands and conducting hand hygiene. And then when you get home, you continue those same kind of measures to help protect your loved ones and your family members who are older and who are living with you and who are at higher risk for more severe infections and potentially death.
We're hearing two different terms as it relates to people who have been infected with the coronavirus. We're hearing that some people say that they're isolating and some people say they're in quarantine. What's the difference?
Right. So there is a distinct difference in when we use those terms. So isolation is for people who are sick, and the length of isolation is based on the presumed length of viral shedding after a person's become infected. And so the guidance is that if you are infected and then if you have symptoms, that you stay at home and self-isolate for 10 days after the first onset of your symptoms, or if you are asymptomatic, that you self-isolate for 10 days after the date of collection of your first positive test. For you to stop isolation, if you have an improvement of symptoms and you're at least 24 hours fever-free without the use of fever-reducing medications, then the viral shedding decreases so much that we believe that you are less likely or not very likely to infect others after those first 10 days. And so the other term that we use is quarantine. And so quarantine is technically for persons who are not yet sick, but who have been exposed to someone who has been sick or who is a lab confirmed positive. And so the period of quarantine is based on the incubation period, or the time from exposure to the time of the first onset of symptoms. So it's the time period from when you're exposed to the time you start to develop disease, or from the time you can become positive. And that's presumed to be right now about 14 days. And so the period of quarantine is based on that incubation period of the disease. And so if you are a close contact and you have been exposed to someone who is lab confirmed COVID, or a person who is ill and has COVID, the SARS-CoV virus, you are requested to stay at home or self-quarantine for 14 days, even if you're not yet sick. And it's to see if you will become sick in those 14 days. And that part is important because there has been shown to be some asymptomatic or pre-symptomatic shedding of virus, in that people are potentially infectious 2 days before they actually feel like they're sick. So this is part of why we're doing all the social distancing, and part of why we're doing all the face coverings and the careful hand hygiene, is that there are people who may be infectious and not yet know it. And so this is why we're requesting that if you don't need to go out or gather in large groups or socialize closely with others, that you don't, because you may be infecting people and not know it.
Alvina, thank you very much for being with us today and sharing those insights, and you stay safe as well.
Thank you.
And stay with us. We'll be right back with more. Let's continue our update from another local medical professional who focuses specifically on Orange County. Joining us is Dr. Christian Zuver, Medical Director for the Orange County EMS system, and he joins us to talk about the numbers starting out. Hi, Dr. Zuver. Thanks for joining us.
Sure, it's my pleasure.
So we're just getting news in that the numbers in Central Florida are starting to plateau. Can you tell us about that, and are people doing the right thing? Is that why that's happening?
Well, absolutely. If the numbers, when they start to plateau, that's usually what we're seeing is because the messaging about mask wearing, appropriate social distancing, and avoiding congregate gatherings are taking effect. We're seeing a plateau right now, which, that plateau is usually, it lags the numbers will lag a little bit behind what the virus is doing in the community. So some of those changes that the mayor has pushed out and that we've been pushing out in our media campaigns, I think we're starting to see them take effect.
How would you rate the adherence to wearing masks and social distancing here in Orange County? Are we doing pretty good compared to other counties in Florida and also compared to the rest of the country?
I'm definitely, heartened to see that our citizens are listening to the advice of the medical professionals and their elected officials by wearing their masks. The tough part is that it's so easy to become complacent, and not intentionally complacent, but just forgetting. And I think repeating that message that we need to continue with this in order to keep seeing improvements in the community spread of COVID is essential.
I think people have to start to realize that masks are now part of our wardrobe moving forward. So that's a hard thing to do for some people. How would you rate the hospitals? Are we starting to see some of the overcrowding that we had a couple of weeks ago starting to slow down a little bit?
We are seeing a bit of a decrease in patients presenting with febrile illness and so fever or respiratory complaints, and the numbers are showing that as well. We are having as expected with that, a decrease in admissions to the hospitals as well. So it's good news.
That is very good news. And when it comes to testing sites, are we still on pace doing the kind of testing that we need to do to make sure that we know where everybody is who has come in contact with people or has the disease?
I think it's a tough question because we test for various different reasons, but the most common reason we test for is so people who are infectious know what their status is and to stay away. So we still have a number of testing sites, both public and private, that are available in the county. We have the Orange County Health Services Department has been running testing for months now, but we are currently in the Econ Sports Complex, and there's testing available. I believe it's going to be Tuesday through Friday of next week. So that's available via the county website, and you can make appointments there. There's also the Orange County Convention Center, which is still ongoing testing site as well, and then the private sites. So I would encourage the public to take advantage of testing at any of those opportunities whenever they can.
There was news announced yesterday that we are anticipating a more active than normal hurricane season. And of course, that always tends to in some way impact Florida. Are you giving advice to shelters and how they should handle the social distancing and other things that they need to do to get through the hurricane season?
We are. And as you know, there's two general types of shelters. We have general population shelters. And then we have the shelters for our medically needy clients, those who have requirements that can't be met at a regular shelter. So we're making planning for both types of sheltering needs. I think one of our big concerns, of course, is our already medically needy individuals. And we are making plans for social distancing at those shelters. We had I don't want to say practice, but we were setting up and preparing for the storm that just came through, and we were blessed not to have to put them into use. But it reminds us of how critical it is to ensure that we go through these processes ahead of time. So we are for both populations.
Excellent. Well, Dr. Zuver, I appreciate you being with us today and always keeping us informed from the front lines. Thank you.
Oh, it's my pleasure. Thank you.
And we'll be right back with more. Stay with us. Grief and loss can be challenging in the best of times, but it's particularly challenging now that people are being told to socially distance. And this is especially true for older adults. Joining me is Dr. Daniel Paulson, a psychology professor at UCF. Dr. Paulson, thanks for being with us today. During normal times, which this is not, how does grief and loss look for older adults?
Grief and loss for older adults are really the same that it is for any of us. Grief is ultimately a process, and when grief goes well, which might seem like an odd way to talk about it, we are better adapted to whatever loss has prompted that grief than we were at the beginning of that process. Grief gives us a way of adapting to a world that has changed, a world where perhaps we've lost something that was meaningful to us or lost someone who was meaningful to us.
And during this period of time, this pandemic and with social distancing, how does it transform, loss or grief transform into something different for an older adult?
Sure. One of the biggest challenges for older adults in the country right now, and in fact worldwide, is access to their loved ones. And where we see that most acutely is in nursing home and assisted living environments, where often the closest they can get to spending time with a loved one is through video conferencing, talking over the phone, or just touching opposite sides of a pane of glass as the family members come to see them from the outside. And this really disrupts those relationships and disrupts their sense of connectedness to other people. And certainly the same can be said for the family members, losing that ability to go into the facility and spend time with people that they love. And going back to that theme of loss and adapting to the loss that I mentioned a moment ago, even though the person may be very much alive on the other side of that pane of glass, or very much alive on the other side of the telephone, if we are used to spending time with people and just exchanging thoughts and feelings with them through normal, what used to seem like very normal interaction, that change can kind of bring on the sense of loss and grief for the absence of that relationship in their life.
And you mentioned that grief is a process, and that people go through the 7 stages of grief. But when should family members start to become concerned about someone who is maybe lingering in one of those steps too long?
The 7 stages, or Kubler-Ross model, is a very familiar way of talking about grief and our response to loss. There are some other approaches that some of us take in mental health that I find to be very, very useful. And my favorite way of approaching the process of grief is by thinking of it as kind of 2 complementary processes. On one hand, when we lose someone or something close to us, there's the experience of that emotion, feeling our feelings, so to speak. Maybe setting up a memorial, maybe celebrating the time that you had with that person, with others. But then there's the other side of it, which is developing, as a person, developing whatever new skills might be needed to fill the gap or the loss felt by that person's absence. So, favorite story I tell in class all the time. One time I was at I was filling up my car at the gas pump, and an older woman pulled up in a Thunderbird of all things. And she asked if I could help her pump her gas. And I said, yeah, of course. And I walked over, and as I was pumping her gas, she told me a story that the car had been bought by her husband, and she had never once filled up her own gas tank. He had taught her to drive when they were teenagers. They got married, and that was just a skill that he brought to the game. He was the one who filled up the gas every week. She'd never done it before. And now that he was gone, she was going to have to fill that role herself. And that was a new skill for her to develop, alongside feeling the feelings and experiencing the loss and the subjective sense of absence from his passing. So from my perspective as a psychologist, when I see somebody who's focusing on building those skills, building the new relationships or developing new hobbies, but they're not really feeling the feelings, I might kind of nudge them in that direction. And the same can be said for the folks who are on the other side, who are feeling the feelings a lot without really reaching out to others, looking for those relationships, looking to build new relationships, looking for the skills and the opportunities that they will need to and maybe want to take advantage of in this new life after things have changed.
So what can family members and loved ones do to show support? And also, what should they not do in these times?
Mm-hmm. I'm going to start with the second part of the question. Social distancing matters, wearing masks matters, and especially for older adults who are so much more susceptible to hospitalization and to death as a result of COVID infection. We really need to be very mindful of those very well-intended, well-advised guidelines. And so if we've been socially distancing all this time, it might be okay to keep that up for a little while longer, and we'll hope that some changes around the corner. That being said, there are lots of things that can be done. Video conferencing is actually kind of a cool thing. I had always sort of looked down my nose as a psychologist at doing teletherapy and talking to my patients over the computer. It didn't seem right, but I've been doing it for months now, and I got to say, it's great. And I've really grown to like it. And I've spent a lot of time with my own friends, talking to them over the computer. And of course, I'd rather be in a room with them, but it's better than nothing. Writing letters is, I think, something that is often overlooked, but writing an actual letter on a piece of paper, maybe holding that for a few days and then putting it through the mail. We know that COVID infection doesn't live very long on paper. And I don't know if you've gotten an actual piece of mail, like an actual physical letter in an envelope from somebody, but it can be sort of a nice memento, a nice reminder that there's an actual physical person out there who cares about you and who took the time to do this thing for you and share those thoughts with you. And then you can return it, and it becomes sort of a fun way to go back and forth with people that you like. And yeah, it's more labor intensive, but a lot of us are sitting at home with time on our hands. So grocery shopping, transportation needs, all the normal things that caregivers do for loved ones, those things still matter. Certainly the delivery of healthcare is more complex than it used to be. And so if a caregiver has been in the habit of taking somebody to the doctor, then maybe it would be worthwhile to see if they can hop on that doxy call with the doctor and with their loved one, just so they still know what's going on in that relationship and they still understand how they can help as a caregiver support that person's medical needs.
Well, Dr. Paulson, thank you so much for being with us and sharing your insights on how we can help our elders get through the loss of a loved one. We appreciate it.
Absolutely a pleasure. Thank you for the time.
And stay with us. We'll be right back. With school starting back soon, our next guest is here to give us a rundown of what's available for youth in our community. Kelvin Curry is the Director of Middle School Programs for the Boys and Girls Clubs of Central Florida, and he joins us today. Kelvin, thanks for being with us.
Thank you so much, Clarence, for having me.
And can you give us a rundown, Kelvin, of what the Boys and Girls Clubs has available for families?
Yeah, so right now, Clarence, we're excited that, obviously during this time of the pandemic and social distancing and isolation, we had the wonderful opportunity to pivot to virtual programming through our after-school zone and summer programs. And right now, we have so many young people in our county who just are in need of connecting with positive adult role models and staying engaged throughout not only the summer months, but also now during this time of distance learning and giving parents those options. So we have some wonderful virtual programs that we're offering that not only meets that mentorship, that connection need, but also the educational need and some other fun choices through arts and crafts and some virtual cooking clubs as well.
You mentioned the virtual classes that are happening at schools. So what kinds of things will kids be able to do at Boys and Girls Clubs since they're going to school virtually now?
Yeah, so the great opportunity now is we have a platform that allows them to engage in tutoring. We call it homework help and tutoring, which is our power hour. And it really helps those kids to stay on track academically. We serve young people from all different backgrounds and ethnicities who really lack the educational support to be successful in life. And so those are some of the things that we're offering in addition to our mentorship opportunities, as well as not only the virtual cooking clubs and international cuisine clubs, but we have fitness programs. We think it's really important. Young people are going through a lot right now. My wife, Melanie, and I have been married 20 years. We have 3 boys and 2 middle schoolers. I have our oldest son is going into the 8th grade, and my youngest son is an incoming 6th grader. So for those middle school students throughout Orange County, we have a platform to be able to serve them through the participating sites for our Boys and Girls Club of Central Florida after school zone. And not only that, Clarence, but we also offer some really fun challenges and free prizes because we want it to be fun. That's one of our core values, is to be fun. So we want to make sure that we're doing that and providing those opportunities as well. And in addition to that, it really supports family engagement. We've heard so much great feedback from our parents throughout Orange County, and they're getting involved in the action as well during this time. So it's not only a great family engagement piece, but it also keeps our young people engaged during those virtual hours that we offer during the out of school time.
You know, everything has been in flux since the pandemic began. How have things changed at the Boys and Girls Club since spring break, for instance?
Yeah, so, obviously when the pandemic hit and obviously there were different changes and we had to adapt. I think for us, the question wasn't, were we going to continue? Our young people matter, and we serve a demographic that goes everywhere from those who are underserved in communities and those who are even in the fluid communities but still are lacking that connection. And so for us, it was just a matter of to continue to fight for our kids and continue to make sure that we keep those connections strong. And so it was really imperative for us to pivot to virtual programming, but not just something that you play on the screen, something that was live, that was engaging, so that they can continue those connections with the positive adult role models. We hire 90% of our employees through our Boys and Girls Clubs of Central Florida after school zone are teachers. And so this gave us an opportunity to continue those connections. And I want to share something with you, Clarence. I had one of our, so much parent feedback that we received. One of the parents said this. She says, "I am very impressed with the variety of activities offered. The leaders have done an excellent job finding exciting new activities and keeping the kids engaged throughout the day." And then she goes on to say that the Boys and Girls Club keeps her interested and excited about activities every day. The program gave my child the opportunity to connect with her peers and teachers and gave her an outlet for fun and educational activities during an unstable time. So, that's what we're doing. That's just in the words of so many parents who have weighed in and just they're so excited that the Boys and Girls Club continues to keep their doors open virtually in a live platform that's not only safe, but also secure.
That's fantastic. And if people want to get more information about the Boys and Girls Clubs, where do they go to get more information?
Absolutely. So we have our main website is www.bgccf.org. That's www.bgccf.org. And then you can even go to our site, the one we're talking about with our virtual programming for our middle school population in Orange County. That's www.bgcafterschoolzone.org. www.bgcafterschoolzone.org.
Fantastic. Kelvin, thank you for being with us, and thank you for keeping the kids involved and engaged throughout this pandemic.
Hey, it's our pleasure. We're here to serve, and we're thankful for this opportunity. So thanks again, Clarence. God bless you.
Thank you. And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe.